I feel one of the most important things I can do as a dental provider is ensure that the right treatment is put to the right situation, right patient. This is termed as treatment planning. When someone comes in with a complex situation or scenario, the number one thing that needs to be done is to find out exactly what it is the patient would like. Once we understand that, we can start to frame the options that are available to them. Then we can sit down and really evaluate somebody's mouth. That's really the next step, is to look at what's going on and start to gather history and understanding of how that's happened. How did we get to that point? What are the factors involved in doing that? Once we understand those components, we can then look at the situation and start to decide, how can we address this? How can we restore what has happened? That takes a significant amount of time. In that process, getting records of x-rays of the teeth, photographs of the teeth, photographs of the smile, evaluation of the smile, evaluation of how the teeth come together, evaluation of the teeth themselves, the gum tissues around the teeth. How are those? How is the health of those tissues? Looking at the x-rays, taking molds of those teeth and relating them into some dental apparatuses that will allow me to see and relate those teeth together. Once we have all that information and that understanding of what the patient would want, what their expectations are, what is available, what has happened in the past, we can generate a plan. Something that's really important in that process is, once we know what the plan can be, understanding the materials, that's a significant factor in generating a complex treatment plan, is understanding what materials are available that work with the oral structures in our mouth and our teeth to have a successful result. If those aren't merged properly, we see lots of complications with dental work and dental treatment. And so the process of treatment planning is the most critical thing that we can do. Once we have all that information, we know the plan that we want, the last step is sequencing that out so that the visits are timely and understood and done properly. Once we have that all in place, treatment plans and the treatment for that patient can go very smoothly and have a great outcome. It's very important to follow those steps so that we can get the result that everybody will be pleased with.